The notion of a child with a runny nose is almost one of those clichéd visions we have of childhood. Hi, I'm Dr. Joe. The nose produces mucus, and it's a useful thing for us. It's part of the body's defensive and protective mechanism. So when the nose produces mucus, it can trap dusts, bacteria, viruses, and a whole range of other things that we don't really want within our body and within our lungs. So it serves a useful purpose. Like a lot of things with the body though, if there's a little bit too much, it can be a nuisance. If the nose produces excess mucus, then it's going to run somewhere. The way the nose is designed, the mucus can run in one of two directions. It can run forwards, giving us the classic runny nose. It can run backwards, giving us a tickle at the back of the throat and sometimes catarrh and that feeling of needing to clear the throat. Again, for reasons that I don't think anybody's quite worked out, a runny nose is more common in children than in adults. Similar to causes for a cough, the most likely causes of a runny nose in a child is some sort of virus or some sort of allergy. Viruses in younger children are extremely common, and a runny nose is the hallmark symptom, probably more so than any other symptom. In most instances, it will be a clear colour, and if it is, that almost invariably tells you that it's caused by a virus in the context of other, cold-type symptoms, a bit of a cough, a bit grizzly off their food, that sort of thing. A clear runny nose can also be a sign of allergies, and that in that instance may be associated with watery eyes or perhaps sneezing or itching. And of course, the treatments are a little bit different. If the nose is running a colour, particularly green, that may indicate some infection in the sinuses, and it could be a bacterial type infection. This is more common in adults than in children, but it does occur in children. That's one of the rare instances where an antibiotic can be helpful. If the mucus is running a little bit yellow, that's a little bit line ball and may be any one of the three, and your doctor can help you with obviously sorting that out. So what sort of treatments can we use for a runny nose? Well, if it's caused by a virus, it'll pretty much need to run its course. What we call symptomatic or supportive measures are helpful, and obviously, clearing the child's nose, helping it to blow the nose if they're old enough to do that is clearly going to be helpful. Some steam or inhalation with or without some eucalypt can be soothing. There are a number of over-the-counter nasal sprays that are used. Now, be very wary of ones that dry the nose. They really shouldn't be used in children. The saline sprays, and there are a few of those at the chemist, can be helpful. And there are a number of decongestants that can be used, but they shouldn't be used in children under 2, and they're not a cure. For children who've got allergy cause of their runny nose, then an antihistamine can sometimes be used. That's like a hay fever medicine, again generally not in the very young age group. And there are some prescription nasal sprays that have a hydrocortisone in them. Now it's a weak hydrocortisone, but it can reduce mucus production in the nose. Again, these are something you'd need to talk about with your doctor. Like with all things in medicine, there are rarer causes, and sometimes a runny nose, particularly if it's on one side in a child, may be a sign that they've stuck something in their nose. And over the years I've had cause to remove a few beads and other interesting objects that children have stuck up their nose. It's uncommon. It happens, but it's not common. So, to sum up, a runny nose, almost as ubiquitous as childhood itself, and generally not a problem. A little bit of a nuisance, maybe not the thing you want when you're about to have a photo taken of the child, but not generally serious. Simple symptomatic treatment, as we've spoken about in the video, will generally do the trick, and obviously if there are any concerns, then have your child seen by your GP and see whether or not there's anything else you need to be doing.